Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome back to our educational series for parents. Remember that these videos do not replace consultation with your pediatrician. If you're concerned that your child is sick, please make an appointment. My office will be happy to schedule an appointment with you same day if need be, 775-359-7111. Today we're going to talk about bronchiolitis. Bronchiolitis is a very common illness in the winter. It affects mostly young children under the age of 2, but it can affect children of any age. It can be caused by dozens of viruses: adenovirus, influenza virus, human metapneumovirus, but most commonly it's caused by respiratory syncytial virus, or RSV. RSV disease is responsible for being the #1 cause of admission for preemies who have left the neonatal intensive care unit to be readmitted back to the hospital. It is for preemies who have left, for micropreemies, children born under 30 weeks of gestational age, who have left the neonatal intensive care unit, who then go on to die in the first 2 years of life. It's the #1 cause of death for those children. So the burden of disease is very high. The disease itself presents with cough, runny nose, and wheezing, although many times the wheezing can only be heard with a stethoscope, so the parents may not hear it. It's a hacky cough. It is often worse at night. It vaguely resembles asthma and can be almost impossible to distinguish from asthma, other than the fact that asthma keeps happening and you shouldn't keep getting bronchiolitis. The cough from bronchiolitis doesn't respond real well to much of anything. In the outpatient, many times we'll try levoalbuterol or Xopenex, or we'll try racemic albuterol, either as an inhaler or as a nebulizer, but realistically the results from this are questionable at best. In the hospital, if the child gets sick enough to need oxygen and to be placed in the hospital, many times we'll also use racemic epinephrine or single isomer epinephrine nebulized to help open the lungs up, and that works a little bit better, but again, still isn't the greatest. Humidifying the room that the child is in helps to loosen up the secretions and helps you to cough the secretions out. Putting some nasal saline in the nose and then sucking it out if the child has a tremendous amount of nasal congestion often helps. Elevating the head of the bed helps. For a newborn, for a child especially under 2 months of age, but anywhere under 6 months of age, thickening the feeds if you're not breastfeeding often helps, and we can do that by adding a tablespoon of rice cereal per ounce of formula. Often helps to prevent some aspiration or inhalation of the food and helps with the coughing. This particular disorder does not respond to antibiotics, does not respond to steroids. It may present with fever, it may present just with cough and runny nose. The cough can last upwards of 2 months. It's very, very, very frustrating, and definitely can be severe enough to land you in the hospital. Patience is critical with this one. There is no magic cure. If you think your child has bronchiolitis or you'd like your child to be seen, if you're afraid that your child is having difficulty catching his breath, then he definitely needs to be seen. Please contact your physician or contact us at 359-7111, and again, that's area code 775. This is Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Here's hoping your child doesn't catch this one.